Hello students, my name is Antony Ruban, Assistant Professor, Department of Radiology and Imaging Technology, School of Allied Health Sciences, Vinay Mission Research Foundation, Deemed to University, Salem. Today we discuss about topic of biological effects of ultrasound. Biological effects of ultrasound means the biological effects of ultrasound refer to the potential adverse effects of imaging modalities as the human tissues. That affect the human tissues means that two primary main mechanisms, one thermal and one mechanical. You can see the slide. The main for first thermal effect affect the tissue, second physical effects that affect the tissues. These both are affect the tissues means that the effects come from the ultrasound. We discussed about thermal effect first. The majority of this turn into the heat, absorbed sound. That absorbed sound means producing heat, that's like the thermal effect. We will discuss that due to the law of the conversion of energy, all the sound energy attenuation by tissues must be converted to the other form of the energy. It is possible for ultrasound to raise tissue temperature by up to 1.5 degrees Celsius. For sensitive tissues, example feature. This raise the temperature may have so much of effect if present of extended period of time. Next, thermal index. Thermal index is the ratio of power produced by the transducer, ultrasound transducer. We know the ultrasound transducer means that effects from transducer device to the human tissues, then reflect to echoes to again receive from the ultrasound transducers. Facts: the 2 to 4 degree raise in testicular temperature can cause infertility. Second facts: less than 39 to 41 degrees should be used in fetal scanning. Temperature raise of 4 degrees lasting for 5 minutes or more can cause hazards, especially for the fetal scanning. Thermal index depends on three measures: a measure of time, average acoustic power, assumption of the properties of tissue being heated already. Before that I informed heated means some heating energy, the sound energy. Assumption about the path of the ultrasound beam. It beam focusing in unchanged, then the thermal index is directly related to the output power of the system. Thermal index, relevant attenuated acoustic power to the depth of the interest. Estimated power necessary to raise tissue equilibrium temperature by 1 degree Celsius. So if the acoustic power of the ultrasound beam is enough to raise the tissue temperature by 1 degree, then thermal index is 1.0. Thermal index currently recommendations. Thermal index currently recommendations the future direction. In 2009, the British Medical Ultrasound Society related guidelines based on the safe use of diagnostic ultrasound equipment. The guidelines also detailed recommended exposure time and index value for obstetric and neonatal ultrasound. For obstetric and neonatal scanning, there is no known reason to restrict scanning with the TI value between 0.07. TA value between 0.7 to 3.0 are time restricted depending on the age of the fetus and tissue being scanned. While the tissue affected biological effects means that it is caused relevant to fetal. The International Society of Ultrasound in Obstetrics and Gynecology recommended a TI value less than 1.0 for first trimester scanning. First trimester scanning 11 weeks to 13 weeks, 6 days. Limited exposure time to Doppler scanning for a little less possible, preferably less than 5 to 10 minutes. Before we discussed, we must know that biological effects of ultrasound, there are primary two main mechanisms, thermal and mechanical. Thermal and mechanical effects. The thermal effects, they affect to the tissues, the physical effects to affect to the tissue. The thermal index, you can see the formulas. Next, mechanical effect. Mechanical effects refers to non-thermal. The mechanical biological of ultrasound refers to damage caused by the actual of sound wave on tissue. The most common is referred to the cavitation, and it is caused by the oscillation of small gas bubbles with the ultrasound field. Cavitation is further divided into two types: transient cavitation and stable cavitations. You can see that slide, two types. This can increase the tissue temperature by more than 1000 degrees Celsius. The gas-filled organs such as lungs and intestines are more sensitive to cavitation effects. Once again, I repeat, gas-filled organs such as lungs, intestines are more sensitive to cavitation effects. Cavitation, stable cavitations, and transient cavitations. Stable cavitation is not dangerous on the tissue. Second one, the bubbles remain intact. Oscillation harmless in the ultrasound field. Second one, transient cavitation is dangerous to the tissue, not like that stable cavitation. The bubble grow and collapse rapidly in the ultrasound beam. It causes very great increase in temperature. Stable cavitation, before that we discussed stable and transient cavitation. Now I explain about that stable cavitation. Stable cavitation refers to this image. We can see the bubble oscillation in the regular fashion. Ultrasound refers to the sound waves. Stable cavitation is not dangerous to the tissue. Second, transient cavitation. Transition cavitation is dangerous to the tissue. Bubble formation, bubble growth and bubble embolization. We can see the 5000 degrees Celsius to that affects. Mechanical index. Mechanical index is proportional to the ultrasound beam's negative pressure or peak rarefaction pressures. Mechanical index is an indication of ultrasound beam's ability to cause cavitation related by effects. Before we discussed cavitation effects. It is also inversely proportional to the frequency of the beam. Therefore, higher frequency have a lower mechanical index. The mechanical index be kept below 1.9 is recommended. We discussed the British Medical Ultrasound Society. For obstetric and neonatal scanning, there is no known reason to restrict scanning timing with a MI value between 0.03. When MI value measures 0.7, there is a risk cavitation if the ultrasound contrast agent containing gas microspheres is being used. The risk increased with MI value above the threshold. Second, we discussed about biological effects of ultrasound. There is two main mechanisms, thermal and mechanical, that both are affects the human tissues. Human tissues means we discussed the thermal effect. Due to the law of conversation, the energy of sound waves attenuation by the tissue converted to the other form of some energy. That other form of energy measured by the thermal index. Thermal index 2 to 4 degree rise testicular temperature can be infertility. Less than 39 to 41 degree should be used to fetal scanning. Temperature rise that 4 degree lasting for 5 minutes or more can cause hazards, especially to the fetus. Second one, thermal index. The British Medical Ultrasound Society released guidelines. Before that discussed the recommendation exposure time and index value for obstetric and neonatal ultrasound. International Society of Ultrasound, Obstetric and Gynecology recommended TI value less than 1.0, 11 weeks to 13 weeks, 6 days. Limited exposure to Doppler imaging, preferably 5 to 10 minutes. Scanning of the embryo or fetus with the thermal index greater than 3.0 is not recommended. Other form of mechanical effects, the transient cavitations and stable cavitations. This can increase the tissue temperature by more than 1000 degrees Celsius. The most common is referred cavitations is caused by the oscillation of small gas bubbles within the ultrasound field. Gas field organs such as that affect lungs, intestines are more sensitive to the cavitation effect. Before that we discussed cavitations, transient cavitations and stable cavitations. Stable cavitation is simply not dangerous to the tissue. Transient cavitation is a dangerous tissue. The bubble remains intact. The bubble growth and collapse rapidly ultrasound beam. This stable cavitation. Stable cavitation, we can see bubble oscillation in regular fashion. Second one, the bubble formation, that bubble growth and bubble embolization. Thank you, students.